A new study finds that a common ingredient found in energy drinks could help fuel the growth of cancers like leukemia.
The ingredient is called taurine, and it is a non-essential amino acid that also occurs naturally in the bone marrow, brain, heart, and muscles. But joining us now to talk about what this means is Dr. Nicholas Cozzi, the EMS Medical Director at Rush University Medical Center. Thanks for being here.
Thank you, Scott and Dawn. Good to see you.
So I want to ask you, I know it's one study, but it found that this ingredient can actually speed up some types of cancer like leukemia. So how is that possible?
So it's a great question. We are seeing in one study in non-humans that this non-essential amino acid, taurine, can speed up specifically leukemia. And while it's something that we need to be mindful of, it's very early and caution is the most appropriate step.
That said, doctor, the discovery, maybe a little irony here, researchers believe it could help treating cancer. Can you talk about that?
So what we usually see is about 500,000 patients in the United States have leukemia. 1 or 3 out of every 100 cancers, 3%, are leukemia in nature. And traditionally, we believe this amino acid, taurine, was essential for the heart, the brain health, especially for individuals going through chemotherapy, because it would help protect them as well as help prevent fatigue. This one study out of the University of Rochester in non-humans is testing that paradigm to help us figure out what is actually going on with taurine and how can we best treat patients with leukemia. To me, this is a positive step because it shows that science is actually on the forefront trying to identify how we best treat our patients with leukemia.
So let me ask you, this amount of taurine inside the energy drinks, is it enough to have an impact on someone with blood cancer? Is it enough to have an impact on someone who's already healthy?
It's a great question, Dawn, and that is something that's too early to make a judgment on. However, as an emergency physician, we see individuals come to the ER who are experiencing side effects of specifically energy drinks, a high heart rate, abnormal heart rhythm, and we caution individuals on taking too much energy drinks or caffeine in general. And it's important to note that while the studies have showed specifically in non-humans that it can be associated with leukemia, we have not been able to show specifically that energy drinks are associated with higher rates of leukemia.
Well, there's been a proliferation, I'm sure you know this, especially on like YouTube, touting the benefits of taurine. What about those already dealing with blood cancers or somebody who is healthy? Should they be worried?
It's a great question. One of the things we want to do, individuals who have leukemia specifically, who may be taking this supplement, I encourage you to talk to your oncologist, your hematologist on the best steps forward for your specific situation. But like anything, moderation is key. We're in an era right now where we're looking at our specific foods, our specific drinks to make sure what are we putting into those specific areas. And so if you have specifically leukemia, you want to be able to talk to your physician to identify should you not be taking that supplement.
All right, thank you. We'll just take a closer look at what we're drinking and eating yet again. Dr. Nicholas Cozzi, thanks.
Be careful out there, Dawn. Have a good day.
You too. Thanks.